Hi, I'm Carrie Cable. For this video, I am going to simulate scrubbing a surgical, or prepping a surgical site. So my watermelon, which I've been known to break a time or two, I drop them, and my husband doesn't let it down. So I have to be very careful with this watermelon. So I'm going to use that as my patient. I just sort of marked a line on it, and then my other supplies that I have here are my bowls, which would be stainless steel. I grabbed glass ones because they were easy to grab. I have some gauze that's cut up. It's not in perfect squares, but it's close. I have rubber gloves, and then I have this is actually fruit and vegetable wash, but it's going to simulate alcohol or iodine or something like that. So the initial steps would be to shave the area and then vacuum it so that we can then scrub it. So I'm going to glove up, and I'm left-handed, so my left hand is going to be my dominant hand, and my right hand will be my non-dominant hand that will pass all of the things over. This glove's funky. Won't let me pinky in. So my left hand will do the scrubbing, and then drop the used gauze into my clean bowl. And so everything is here kind of ready to go. So I will use my right hand, my non-dominant hand, to spray. I'm going to spray the gauze a little bit too. It's going to pass it to my left hand, my dominant hand, and I'm just going to clean in circular motion, kind of in a target, as we've talked about and covered. And then when I get back to me, kind of on this back side, I'm going to drop it. I'm going to do this again, and you need to do this a minimum of 3 times, or scrub needs to be on for a minimum of 10 minutes. I've seen some videos that say 5 minutes, but others say 10, so I'm going to go with the 10 minutes. We're going to spray again. Oops, I haven't touched it. I'm going to pass it over, and again start in the center, working our way out. And that's been 3 passes, but I have some more gauze, so I'll do it again. So we're gonna spray and just make sure everything is completely done. So this is my last one. So we'll do this. I'm doing the circular, the target motion, and then when I get back on the back side, then I'll drop it again. And so then that would be prepping, and this again would go 10 minutes, or you'd have it on there for 10 minutes, but a minimum of 3 passes at the very, very least. I think I covered everything. So that is, you'd have, like I said, you have your site, you shave, you vacuum, you should have stainless steel bowls, you have your gauze, you have your iodine or your alcohol or your surgical scrub to prep the area, and make sure that you're not cross kind of contaminating, and just your dominant hand does the scrubbing versus your non-dominant hand passing you the items. So I think that's it.